through the Financial Aid Office or Office of Student Financial Services. It's Kevin, he is our student director. This is Laura Hardwick-Crosby. She'll be presenting today. She's the director of the Student Health Insurance Office. How do you refer that to you?
Student health insurance.
Very good. So I'm going to start off by going over some of the important terms you see on the handout. So when Laura's going through the presentation, you'll understand what she's talking about, because we'll be going right into just the specifics of certain terms. This is just an overview, so it's good to get this first. So the first part you see for copay, which is what you pay at the time of service. So if I go to the doctor for a cold and I walk out with the doctor, I pay before I leave a certain amount, which usually is $20 or so to me on my plan, because insurance does not cover everything. Deductible is what you pay for your insurance before your insurance starts covering it. There's a certain amount that differs for each plan. A pre-existing condition is something like diabetes or heart disease that you had before you start a new plan, and so your insurance, so you have to start with that knowledge that you have this condition, which can affect in some laws, and you might get into that, can be affected by your insurance, how much you pay for your insurance. Premium is how much you pay monthly or quarterly for your health insurance. For example, through my employee plan, I pay around, I think it's $100-ish each month for my insurance. The network, this is really important if you're looking for new doctors or if you've just arrived here at Georgetown. It's the people that have contracts with the insurance company that you can get your insurance through. So you can't show up at a random doctor and hope or expect they'll get your insurance. You need to see what network they're in before you get any work done with them. Out of network is just the opposite, the people who are not in your network. They either will be completely uncovered or not very covered. It's different than the in-network, which has more coverage. On the back, I'm skipping a few to get to the more important ones. So co-insurance is a percentage of the cost of treatment that the insured is required to pay. So that's important when you're knowing if something is completely covered or not completely covered. So keep looking at this throughout the presentation if you get confused or don't know a term. Also, the general descriptions on the left are really helpful for understanding not the specifics of your insurance, but generally how insurance would work. And so Kevin, can you come up here and explain a little bit about common sense before we start?
So good evening, everyone. Thank you for joining us tonight. So just a brief introduction. Common Sense is Georgetown University's premier financial literacy program. We're celebrating our 10th year right now, so we've been here on campus since 2006, and what we do, we hold workshops with different offices on campus and external parties to help bring personal finance information to undergraduate students. And I'm pleased to present you to our presenter today, Ms. Laura Hardwick-Crosby. She graduated from West Virginia University, undergraduate with a degree in political science and a master's in industrial relations. She followed that up with a certification in benefits administration here at Georgetown University. And she's held various positions here at Georgetown University, including responsibilities in medical administration, university financial affairs, and over 20 years in student health insurance. So please help me welcome Ms. Hardwick-Crosby.
Hello, everyone. Thank you for being here. Kevin, could you please make sure that that is passed out? Thank you. So the first thing I'm going to do is go over the PowerPoint. Then, if we have time, we'll talk about the Premier Plan, which is the plan that I administer. I am going to use the benefits in the Premier Plan as examples. But certainly other people have other plans that I'm not really qualified to talk about. And then I'll also talk about some of the, what's called the Affordable Care Act that was passed in 2010, and different regulations have been phased in. And there'll be some conversation about that to the extent that those regulations are helpful to you in making decisions. And then at the end, we'll have a Q&A, okay? So, question is, should you care about who insures your plan? What insurance company insures your plan? I thought I would let you know that United Healthcare insures the Premier Plan, but I thought to myself, well, why do you really care? Well, in part, it's important because you need to know, and I have it in the fine print here, that the United Healthcare Premier Plan is a fully insured AM Best financial rating of A. So you know that if we don't charge enough premium, or if United Healthcare doesn't charge enough premium, and your claims exceed everything that we've collected, this is a fully insured plan, and United Healthcare holds the financial risk. So you can be rest assured that your claims will get paid, for example. And before ACA, you would every once in a while hear about somebody who kind of creates their own plan and collects money, and it's really a Ponzi scheme. And you don't see that much anymore, but they used to be out there. The insurance plans are now regulated. So number 2 was, if you were to choose, if you had the option to choose between these 2 plans, the United Healthcare plan, a comprehensive plan for $2,460 per year, or the plan I have to offer, Laura Hardman Crosby, for a comprehensive plan for $1,000. If you didn't know anything about insurance or anything about United Healthcare, you might be inclined to choose the less expensive one. But that doesn't really exist. I could collect your money and I could hold on to it for a while and then I could leave town. So that's why you care about who insures your insurance fund. You want to make sure that they have enough money. So as I said, United Healthcare insures the Premier Plan, and that enables that if you have, there's enough money to cover all of the claims. So unlike an employer plan, the employer holds the financial risk on a self-funded employer plan. But a fully insured plan, the insurance company holds the risk. So how do you know if a plan is a good plan or not? So you're shopping around and you're trying to figure out, should I buy this plan or not? Well, the ACA regulations that were passed in 2010 created metallic categories so that you could look at plans offered in the United States that are ACA compliant, that's the Affordable Care Act compliant, and depending on what that metallic rating is, you could determine how good that plan is. So the different metallic ratings are from the highest is platinum, the next is gold, next is silver, then bronze. So all of the Affordable Care Act compliant plans have one of these metallic ratings. And so when you're shopping, you can tell what's the best. And of course, the prices differ accordingly. Now, these plans are assessed on actuarial value. Actuarial value is the percent a plan is expected to pay out. That's all of the claims for a plan, not just you, but not just one person, but everybody in the plan that is expected to pay out for the average cost of essential benefits. So essential benefits are basically the benefits you would expect the plan to pay. So when you're trying to decide, and if you see a plan that, for example, has a $75 charge per visit, or the one that pays 70% per visit, how would you know which one is better? Do you choose the one in which you have to pay a copay of $75, or would you choose the one in which you have to pay co-insurance of 30%? You don't really know. So how do you know that? Well, you don't have to worry about that anymore. You just look at that metallic category, and if one is platinum and the other is gold, then you know which one pays more for essential benefits. The Premier Plan is a platinum plan. Definitions. That's something else that you should be concerned about. Definitions can be tricky. And again, the definition sense of the Affordable Care Act are much clearer, more user-friendly, and more standard. But, for example, here are two different definitions. And which one of these definitions, and I'll ask for a show of hands, do you think equates to excluding pre-existing conditions? Definition number one, sickness means sickness or disease which causes loss, well insured, or definition number two, sickness means sickness or disease which causes loss and first manifests well insured. So question number two excludes pre-existing conditions, which means if you had a plan that excludes pre-existing conditions, it wouldn't necessarily say that. You would have to look at this definition and say, oh, I have to get sick while I'm insured by this plan. Last year when I was under this other plan, when I got sick or injured and I still have treatment, it's not going to be covered under the new plan. So, however, because of the Affordable Care Act, pre-existing conditions have to be covered. So there are some exceptions to that, and that's what's called short-term plans. And the short-term plans have lots of exclusions. Short-term plans don't have to follow the Affordable Care Act regulations. And so those are the ones that you need to be particularly careful about reading the definitions and understanding what it really does cover. So the Premier Plan excludes pre-existing conditions, or does not exclude pre-existing conditions. It's a Affordable Care Act compliant plan, and it's covered them for a very long time. So let's talk about medical emergencies. And what's important about a medical emergency is when you go to the ER, you want to make sure it's really a medical emergency. It's not, don't use it as the alternative to the doctor's office because you're sick on the weekend, if it can wait. Because if it's not a true medical emergency, then it doesn't get covered. Or in some plans, it might be that it just covers less and that you end up with a large out-of-pocket cost. So for example, the Premier Plan, some of the terms in the definition is that it must be, the condition must be sudden, serious, and unexpected. And it would be reasonable for a person to believe that the condition would result in death or jeopardy of health or serious bodily impairment, or those things to the fetus. So when you go to the ER, just make sure that it really is a medical emergency. If not, wait until the doctor's office is open on Monday, if it's the weekend. So what's covered under the Premier Plan? Well, the essential benefits that the Affordable Care Act requires to be covered are covered under the Premier Plan. And these essential benefits, these top 10, all plans that are ACA compliant have to be covered. It's your outpatient, your inpatient, emergency care, maternity care, mental health and addictions, prescriptions, rehabilitation, labs, preventive care, and pediatric benefits will include dental and vision. So when you're looking at a plan, or at least I'll talk about the Premier Plan, what doesn't it cover? And so that's when you know that it's a Affordable Care Act compliant plan, you know it covers all those things. Now you're more interested in what doesn't it cover. We'll look at the exclusions. It's really important to look at the exclusions. And on the Premier Plan is just a medical plan. That means it doesn't cover dental and it doesn't cover vision. It's just medical conditions. Now, on the Premier Plan, how many people are enrolled in the Premier Plan? Just a few. All right. So it does have what's called a dental discount network. And the reason why we do that to purchase a voluntary dental plan is usually not of good value because it's voluntary, and when you purchase it, you're probably going to use it. It's called adverse selection. And so everybody who buys a voluntary dental plan typically uses it, and therefore it's expensive and not a very good value. But dental discount networks are a good value. And so if you're insured by the Premier plan, there is a dental discount network, and you can click on, and all the dentists are certified and have been reviewed. You also want to look at what's excluded on your plan. So there's plenty of things that can be excluded. And for example, on the Premier plan, some high-risk activities such as skydiving is excluded. Medically unnecessary treatment is excluded. So an example of that would be cosmetic surgery. That's kind of the typical example. So if you have a condition, make sure that you know the plan. It's your responsibility to read your plan benefits and understand them, especially if you have a condition that you're concerned about. And what's also, because the doctors don't know your plan, and the doctors will refer you to the places that they know, to other doctors that they know are the best. But that doesn't mean that those doctors are part of your plan. So when you go to another doctor, so you go, let's say, to the Student Health Center as your primary care physician, and they refer you out, make sure that when that referral happens, call your insurance plan. Make sure that the doctor that you're going to is part of that plan. If not, you might need to get another referral, or you can go online and look up who the preferred providers are. And I'm jumping here a little bit, but the preferred providers on your plan will bill the insurance company for you. So that's great. You don't have to pay for everything up front and get reimbursed. So that's another reason, if your plan allows you to go outside of the preferred provider network, that you want to stay in. The service is just easier to file a claim. The doctors will do that for you. So what is a copay? We already talked about that. And it's the payment that you make at the time of the visit. Some other terms, date of service is another term that's used a lot in healthcare. So if you go to the Student Health Center, let's say for a sore throat, the copay would be $10, paid on the day of the visit, the date of service. What is the deductible? So this is a recap. The deductible is the amount of money you pay per plan year before the insurance company pays anything. Now, with the Premier plan, there's kind of a hybrid, what's called a point of service. So depending on where you go, determines what your deductible is and what your copay is and what your co-insurance is. So with the Premier plan, you go to the Student Health Center and there's no deductible. Then if you go to the National PPO network, then there's a deductible per plan year. And then if you go outside of the PPO network, there's even a little bit larger deductible. So look at your deductibles and understand when they apply and when they don't. What is co-insurance? So co-insurance is that cost sharing that is usually represented as a percent. So you'll see plans of 80-20 or 70-30. And with the Premier plan, that cost sharing in network with the PPO network is 80-20. You're responsible for 20% of a really deep discount with United Healthcare. Those discounts I've seen probably average up to 40%. So your 20% that you're responsible for is of a deep discount. When you go outside of the PPO network and with the United Premier plan, it's a national PPO network, so you typically don't have to go out of network unless you really want to. Then the plan will pay 70% of what's called customary, reasonable customary, and you're responsible for the 30% of what's reasonable, and anything over and above that. So for example, if there is a doctor that's outside of the PPO network, and that doctor is kind of a boutique doctor, sees all the stars, all the Hollywood stars, and that doctor, in order to see that doctor, they charge $1,000 for a physician visit, and the Typical cost is $100. Now again, this would be an out-of-network doctor. Then the Premier plan would pay 80% of that $100, and you would be, or no, 70%, excuse me, and you would be responsible for the 30% and anything over and above that. But you got to see the boutique doctor, so there might have been some benefit in that. And this just explains again, you are responsible for the charges when you go to a doctor. So you have the plan. If you're in network, there's some very specific responsibilities that you have. 20% of the negotiated preferred provider rate. If you go out of network, you're responsible for everything that the insurance company does not pay. So make sure that you're going to a preferred provider. Unless you have a particular doctor you want to go to and you're satisfied with what they charge and all the other services. So how do you find a PPO provider, a preferred provider? Typically, this day and age, there is a website with your plan, and you just, you go to that website, click it on, and you give the zip code of where you are and probably the specialty, and doctors will pop up that are part of the plan. You can always call, but I find that the online service to really be the best way. And the other thing to be careful about is when you have an insurance plan or an insurance company, they have several PPO networks. United has a couple of different options, and one PPO network is larger than the other. And that's probably because they're paying a little bit more to the doctors. The doctors then join the other network. They pay less, fewer doctors join, so it's just a smaller network. In the end, you save money on the plan, depending on which one the plan manager chooses, but that's the trade-off. Smaller network or a large network that costs a little bit more. The Premier plan is the larger network. Do you, in terms of the Premier plan, do you need to reapply for health insurance every year? So we go through the open enrollment process for each student one time, each eligible student one time per academic year. And probably 90% of the students who are eligible in the fall. So we just ended open enrollment on September 15th. Everybody who had other adequate coverage submitted waivers. We took a look at the waivers and we asked for additional information if we weren't familiar with your insurance plan, and hopefully we waived it. If not, we may have denied it for reasons that we explained. For example, we just don't know and typically we don't know if there's coverage in the DC area. If you have a plan that's an Affordable Care Act plan, you're going to meet our requirements with one exception. The Affordable Care Act plans have a tendency to be regional. And so you live in another state and it doesn't cover you here. United Healthcare is a worldwide, the Premier plan is worldwide coverage with a national PPO network. So rest assured you can use it when you go home. But many of the ACA plans are regional, and so we take a look at that when you're submitting waivers. And if you don't submit a waiver during open enrollment, you eventually will be if you're eligible for the Premier plan, undergraduates taking 9 or more credit hours, graduate students taking 8 or more, then you will be enrolled after September 15th with a retroactive effective date of August 15th. So you don't have to actually reapply, but if you want your name to go to the insurance company during open enrollment sooner rather than later, fill out an acceptance form and we send those names down weekly. So this question is, if you already have insurance, that's when you can waive. And we will take a look at your waiver, see if there's coverage, the coverage meets our requirements. We have a web page about that. And if it does, then we will waive you for the academic year. And after open enrollment, you can't change your mind. You can't say, oh, I really don't like my insurance. They don't cover as much as I would like here, because we really, we're looking for urgent care, and that's about it in terms of coverage. And of course, hospitalization, emergency and urgent care. You can't change your mind and jump back on our plan after open enrollment. So look at that carefully and make sure that you really do want to waive. There are exceptions to enrolling in mid-year, and that's if you're involuntarily dropped due to age or employment from your other plan. And then here's our website. And it's about the Premier Plan. And this is the summary about the Premier Plan, and it has all of our phone numbers here. And I'll leave it at that and just open it up for questions.
Actually, I have a question. When I was a student here, I did study abroad, and study abroad insurance was really weird and complicated for me. Can you explain what I should do, what a student would do if they're doing a study abroad program and they don't know if their insurance covers that or not?
So, regardless of whether you have the Premier Plan or not, the undergraduates are, when they are in a study abroad program, are required to enroll in the study abroad insurance, which is $60 for any part of a trimester. And that coverage is really good coverage, up to $500,000 for unexpected illness or injury. It's a short-term plan. It does not have to follow the ACA requirements. So it's really intended for that time abroad. It will not cover you in the United States. It will only cover you while you're on your trip. And it's primary to the Premier Plan, and it's should be primary to your other plans as well. And that is the reason why we want students to have that, is so that when you're abroad, we have a mechanism as an institution to help manage your medical emergencies. Hopefully you don't have any, but when you do and you're abroad, the university wants to be able to be as helpful as possible. And it's so inexpensive that $60 per trimester, that it's a really good plan for that purpose. And it covers, if you have an unexpected illness or injury, up to 100%, up to $500,000. So, and that it also has really nice travel assistance services so that we can help to get you back to the United States or your home country if that's what is best for the circumstances. So that helps you and it helps the university too. Does that? Yes.
Question about when you mentioned that some ACA plans tend to be regional.
Yes.
Does that mean that if you have one of those plans, you can really only utilize service in that region, or
Correct. So
care somewhere else?
So the ACA plans are developing over a number of years and how to keep costs down in part. And so there is a trend where many of them, and they're often employer plans, are the PPO provider, the preferred network is regional, just in that state or even a portion of the state. So when you come to Washington, D.C., there's no coverage. And we ask for more than just emergency coverage. We want at least urgent care. And of course the hospitalization, and our website indicates exactly what we're looking for. But it's more than emergency care.
Can you briefly go over the difference between emergency care and urgent coverage, emergency coverage, urgent care?
Well, urgent care, there is some nuance to that, but urgent care often there are facilities where you can go for urgent care. They're open 24/7, but they don't have the emergency room providers for everything that could happen, some of the traumas and things like that in an emergency room. So it allows you to go to the doctor when it's not a gunshot wound, and you're going to go, for that you're going to go to the emergency room. And if you didn't have urgent care, that wouldn't get covered. So urgent care allows an outpatient visit that so your condition can be covered, and you can take care of that urgency that isn't appropriate to go to the emergency room. Yes.
What's an outpatient versus inpatient?
So most visits are outpatient visits. When you go to the student health center, to your primary care doctor, when you go to a specialist, let's say an allergist, when you even have a broken arm, but you don't have to have surgery, you just need it set. Those are all outpatient visits. You are never staying in a bed in the hospital. So inpatient is when you actually spend the night in a hospital. That's inpatient. And there are different billing systems for that, much more expensive, but extremely important when the condition is that bad. Yes?
I'm looking at an explanation of benefits right now, and then you mentioned that the deductible is still a portion of your healthcare that you pay before insurance starts covering it. So if I get an EOB with suddenly the smallest deductible, should I expect a bill, a separate bill?
So the question is about what's called an explanation of benefits. So every insurance company is to issue a document that's called an explanation of benefits for any claim that is sent to them by usually a provider, and it explains what they've done with that claim. It might say it's been denied because we don't cover whatever it is, or it might be denied because they want medical records. Or it pays for a portion of the claim. And it typically lays out in columns what was received, if it's a preferred provider, one column will reduce the amount of the claim because they have a discounted amount, and they'll put that amount, and that's your discount. And then from that, they'll subtract, if it's the first time you've gone to the doctor that year and your deductible has not been applied yet, then they'll say, let's say it's $1,000 claim and you've never been to the doctor that year. So and you have, excuse me, a $200 deductible. But they also have, don't test my math too much here, but they also have, let's say, a 20% discount. So the first column will have $800, and then you owe $200 before the plan pays anything. So now there's $600, and they'll pay 80% of that $600, and you'll be responsible for 20%. So that's how that explanation of benefits will be laid out so that you can see what you owe. Now, that is not a bill. That is the insurance company telling you, I received this and this is what we did with it. You want to wait for the provider to send you the bill that says, you owe me X amount, and you're going to look at that bill and compare it to the explanation of benefits and say, the insurance company agrees with that. Or you're going to say, wait a minute, the insurance company has a different amount and it happens to be less, so I need to wait and find out what the problem is because I don't want to pay the higher amount. And certainly people can, and claims can be very complicated, and especially if you have a lot of claims and it's hard to keep track of, and if you're insured under the Premier Plan, we're happy to help you with that. Sometimes I have to pull out spreadsheets, create spreadsheets to follow it. So it can be complicated. You had a question?
So, we supposed to have received the cards by now?
The cards have not been issued yet because I was looking at the addresses and updating addresses, and I do not believe I authorized it yet. When I get back to the office, I had a conversation, and I think I need to double check and see. But they will go out. If they haven't already gone out, they're going out. There's some question as to whether I authorized it or not, so I'm going to go back and see what I did. Yes?
Where do taxes play a role in insurance?
So the Affordable Care Act requires students, not everybody, in the United States to have health insurance. And if you don't, then there's a tax penalty. And that's where, so if you don't have a compliant plan, and I don't do my taxes, my husband does, so I'm not sure how the forms look, but they're asking, the insurance companies are asking, or excuse me, the IRS is asking for the insurance information to see if you have a compliant plan, and if you don't, then there's a tax penalty. Now, to the extent that you don't make any money, I'm not sure there's any tax penalty. I'm not sure how that works. So.
If you do have a plan, though, do you still have to pay? Is there still some other tax for buying health insurance, or?
So if you do have, so if you do have a compliant plan, then there's no penalty.
Okay.
So they're just asking for the information. That's my understanding. Other questions? Yes?
So, do most plans cover like chiropractic care? I haven't seen many.
The Affordable Care Act requires it.
Oh,
At
really?
least in DC they do. So the Premier Plan does. Now some of them, well, it's rehabilitative services. So chiropractic care falls under that. So physical therapy and chiropractic care are essential benefits. Yes, it covers it. Now the thing about physical therapy is it has to be medically necessary. So physical therapy is one of those treatments that could potentially go on forever, unless they kind of check, the insurance company checks and says, all right, well, the standard of care for this injury is 20 visits and this is 40 visits. Let's look at the records and see what's going on. So, they have the insurance company has standards of care, and they will ask for records when something is sort of outside of that standard. Physical therapy is one of those they always look at after a certain number of visits.
So if a student is on a Premier plan, and are they covered after the academic year has ended, per se, over the summer, when they go back home, per se?
Excellent question. So the Premier plan is a 12-month plan that begins August 15th, and it goes through August 14th of the following year, and that's exactly for that reason, so that you don't have any gap in coverage, so you can go home and not worry about not having coverage. And then the next year we start all over again, so there's no gap. And there's what's called a continuation plan if you're insured, but under the Premier plan, so that if you when you graduate, if you're insured under the Premier plan the year before, and you're not employed yet, and you don't know what your insurance coverage will be, you can pick up what's the 6-month continuation plan for half of the price of the negotiated rate that particular year. It's the same plan that the students here receive.
And they contact your office directly for that, for a senior who's graduated, don't know what their plans are, they just contact your office directly for that.
So students contact the Student Health Insurance Office. The insured students from the prior year get an email that says around March or April, if you're not going to qualify for the Premier plan next academic year, get in touch with us if you want the voluntary 6-month continuation plan. At that point in time, we haven't negotiated the rates, so we can't give them all those details, but there's a deadline of August 28th that's a little earlier than the open enrollment deadline, so it's important to be very prompt about that. Yes.
So in my experience, there's definitely this idea that mental health care or therapy or counseling is extremely expensive and just kind of unattainable. Can you just visualize state if that is true or if there's copays for that or demystify that a bit?
So mental health in the United States and under insurance plans historically has had different copays, different co-insurance than doctor's visits. And were more restrictive, would have plan limitations, and et cetera, but not anymore. So there's what's called mental health parity. And there's not a lot in the Premier Plan about outpatient mental health because the benefits are the same as physician visits. And so there's not that much to say about it anymore. And so that is no longer the case. The biggest challenge that we have here, and I suspect it may be across the country, is the mental health providers aren't that quick to join a discount network. They seem to be happy with, in our plan, the 70% reimbursement. So that's where you want to get a good referral. It's really important, especially with mental health, because you don't want to spend a lot of time with somebody that, one, maybe it's not a good fit. So you want a good referral. The counseling and psychiatric service here on campus is a great place to go. Initially, they know the best mental health providers in the area. They will refer you. They'll see you for some visits and at no cost. And at some point, they might refer you to doctors that they know are good. And that's really important. I went out on my own once for a dermatologist, and I so regretted it. I didn't want to be in the office. It was dirty. And I couldn't believe. I had never done that before. I'd never gone out on my own and just clicked on the provider network and said, oh, I know that neighborhood. I know how to get there. And I wanted to run out, but I had spent enough time to drive that I stayed. So get a good referral. Referrals are important. Go to the Student Health Center, go to the Counseling and Psychiatric Service. They will make sure that you go to appropriate providers. Yes?
So, we're back on the study abroad thing. If it's a required component of your program, and does it get billed in fall, or do you still have to let you guys know and pay the extra $60?
I didn't hear the last, so the way, I didn't quite hear the last question, so I'll just explain how it works. When you are going abroad and your program requires you to have the study abroad plan, there's two ways that the insurance office finds out about it. It kind of depends on whether it's undergrad or graduate and things like that. But eventually a charge will be on your account. And we receive the terms of the departure and return dates of the program, and that's how you get charged. So if you were going to leave, let's say, September 15th and return December 15th, you would be charged $60, and you would have coverage from September 1 through December 31st. So, and the reason why that's important is maybe you wanted to go early and enjoy yourself, or maybe you wanted to stay a little longer and enjoy yourself. Well, you still have coverage for that whole portion of that trimester, September 1 through December 31st. You need some travel time coverage. Okay? Yes?
If I'm a student enrolled in Premier Plan and I suddenly drop out,
So the question is, if you enroll in the premier plan and then you go on a leave of absence, and it depends on what kind of leave of absence, and it depends on when you go. So if you enroll in the premier plan, but you haven't attended classes for the first 31 days, and you go on just a leave of absence, then you're not eligible for the plan. But let's say you enrolled in classes for the first 31 days, then you're eligible to stay in the plan, but you will have to contact us because there is programming in the student system that's going to take that charge off. And so you have to be proactive. Most students are perfectly happy to have that charge off. But some students, and then others want the insurance, and they'll have to pay for it. And their student account is not active anymore, so they have to actually pay, write a check. Then there's the medical leave of absence, and that's more liberal in terms of the timing of all of that. There's a little more of a process there. Yes.
Take advantage of the discount network. You have to use your membership card and sign up with the discount network, am I right?
The dental discount network is, well, there's a couple of discount networks. The United one, you do need your card, but I recommend the dental discount network. If you're in the premier plan, obviously, the basics dental discount network. So that is a plan, a discount network that you can see the charges you can see the discount on some of them. So this is, you can click through our website, you get to here, the basicstudent.com, and you choose Georgetown, and it will take you to some of these, and you agree to give your firstborn, and then you start looking at some of the providers. And some of them will give their fee schedules, and then others you have to call. Okay. And I haven't been in this site for a while, but there you go. So there's some providers right there, some dentists right there, okay, in the DC area. And so this is a company that is part of the Georgetown plan, and they actually go to these dentists' offices to make sure that they exist, that they're clean, that they meet certain standards. They're licensed. There was a plan once that was a voluntary plan that students were given access to years ago, and we started receiving complaints that the office was horrible. So we're happy to provide this because we have confidence that the offices have been visited and it meets a certain standard.